Hey guys, what's up? Good morning. Welcome back to Nurse Catherine here. It is currently 6:10, so I only have 5 minutes before I have to leave to go to work. But I just wanted to touch on a topic with you today. Something that I find a lot of new nurses struggle with, and not just new nurses, even those nurses who have been in the field for a long time, somewhat are burned out now. And this is just a topic that I feel strongly about. So today's topic I'm touching on is, in the workplace, how do you deal with difficult patients and family members? Now, I'm not just talking about like your dementia patients who are difficult to work with because of how confused they are. I'm talking about your totally alert and oriented patients who just you can't make happy. That nothing you're doing is making them happy, nothing you're doing is right. How do you deal with that? How do you deal with people coming at you, verbally attacking you, hopefully not physically attacking you, but how do you deal with that as a new nurse? You haven't even been on the floor, or even as a not retired nurse, or even as a seasoned nurse. How do you deal with that? A lot of people sometimes make it worse. I want to teach you about the de-escalation period. In this video, I am going to share with you all 2 key phrases that will work every single time when you are dealing with a difficult patient. Okay, so let's make up a scenario. So let's say you have your 5 patients. One patient you have is your more difficult patient, the person you cannot make happy. Say they're there for cellulitis in their leg. They need a walker to walk to the bathroom and they're assistive one to get there. So they call out to use the restroom. You're super busy. Your nurse aides are on sides of the hallways. That's what we call it when they each have one full side. And you have your other 4 patients or 5 patients. So they ring out to go to the bathroom, and it takes a little over a minute and a half to get there. Now, some of you may be like, a minute and a half? That's not really that long to wait. Well, yes, it isn't for some people. It is a long time to wait for some people, especially if you have to go to the bathroom. So you get there and this patient starts attacking you. Not physically, verbally. Why did it take you so long? You're such an awful nurse, da 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 da. And not only the patient is starting to do this, but the family member is as well. And they're just like, you guys need more help. I can't believe how short-staffed this hospital is. I've heard all of this before. You need to get here faster. What do you say? What do you do in that situation? This one and only thing that I do every time seems to work. So they just verbally are like attacking you. Maybe they're swearing now. Maybe they're saying they're going to write a letter to your boss, or they want to see your boss. So you know what you say? This sentence, this is all you have to say. I hear what you're saying, and I'm understanding what you mean. I am sorry you feel that way. That's it. That's it. Don't ever feel the need to explain yourself to your patient. You do not need to explain to them that you were next door coding a patient, or that you were next door matting a patient, that somebody couldn't breathe, that you were suctioning a trach, that you were helping somebody else to the bathroom. Don't explain yourself. That just makes it that much worse, and then they will want to keep on complaining to you. So leave it at that. Say, I understand what you're saying. I hear what you're saying. I will bring it to my manager's attention if it does need to be brought to your manager's attention, and just let them know that you hear what they're saying. They just want you to feel like that they have that autonomy there and that they are able to care for themselves. Now, let's escalate the situation a little bit more. So say this person is starting to actually call you names, call you swear words. Now, in this situation, you do need to just stop it there and say, I will not stand here and listen to you swear at me and call me names. I will be back when you are able to have a conversation with me with not verbally attacking me. And not gonna lie, I have done that before. I have said those exact words to a patient. I got all red. I was like fuming out my eyes. It looked like it. And I was so upset. This person was swearing at me, and if anybody knows, you can ask any of the nurses I work with, I someone gets me upset, I do get upset, but I'm not going to take it out on them. I'm just going to walk to the side and just figure out how to get through that situation. I pray a lot, so I pray about things like that, but I have said that before. And you know what happened? This patient was screaming at me, literally screaming at me as I was leaving the room. And I will say, all of that screaming was because I would not give this patient 2 extra sugar packets. Yes. Welcome to healthcare. Yeah. Anyways, so I wouldn't give them the sugar packets. They were fuming at me, screaming, calling me cuss names. And you know what? I said that. I said, when you are ready to have an adult conversation with me, I will be back in this room. Probably should not have had said adult conversation, but I did. And when you are ready to have an adult conversation, I will come back. Left it at that, and I walked out of the room. So let me just reiterate, at the end of the day, what are you going to do? When you are in this situation of somebody getting very upset, very unhappy of your care, what do you say? You say, I hear what you're saying and I acknowledge what you're saying. We will work on it to the best that we can. I will bring it to my manager's attention, and I'm sorry you feel that way. And when someone is swearing at you, what are you going to say? You say, I will come back when you are ready to have a conversation. In the meantime, I'm going to step out of the room, and when you are ready, I will come back in. Guys, that's it. That's all you have to do. Do not let your patient's emotions and family members, your patient's family members' emotions get the best of you. You do not need to be crying at work. You do not need to be upset at work. You just need to squash the situation, keep on moving with your day. Make sure to check out all my other videos. I have a ton of relevant content for new nurses, for seasoned nurses, nurses of any kind. Don't forget to subscribe, like my videos, share them, comment on them. Let me know if there's any topics that you want me to touch on. I am almost at work, guys, so I am going to tune out. I hope you have a blessed day and get out there, be professional, and know how to deal with those difficult patients. Adios!